open. Good morning, and welcome to REACH's first community town hall. You know, REACH stands for the Roseland Equity and Community-Driven Health Collaborative, committed to transforming health outcomes on Chicago's far south side through equitable and compassionate care. We thank Oakdale Covenant Church for hosting this groundbreaking event, which speaks to our Black Church initiative, Each One, Reach One. At this time, we would like to introduce Pastor D. Daryl Griffin, who will come to us in just a minute to give us a prayer. I would also like to recognize any community leaders and elected officials at this time. Yes, we have Ms. Melva Brownlee, and she's from the Office of Cook County Clerk, Monica Gordon. Thank you. Today we've gathered as a community committed to reaching up and reaching out, leveraging our resources and expertise to reduce and eliminate health inequities. REACH operates within the broader context of the Roseland Medical District and is part of a larger movement to transform healthcare in Chicago's far south side. At this moment, I would like to introduce the pastor, Dr. D. Daryl Griffin, for prayer.
Thank you all so much for being here, and what an honor it is for us to host this most important event. Healthcare in our community is desperately needed, and this is certainly something that we all need. Mental health is a challenge in our communities, and having access to healthcare is becoming more and more of a challenge. So these events are so important so that we can raise awareness when healthcare has been cut in certain areas where we can go for the necessary help. So I am grateful for this wonderful opportunity. Let's pray. Lord, you are so good and so mighty, and we thank you for those who have put together this program today to raise the awareness of what is going on with healthcare in our communities. And so, Lord, I thank you for the REACH program. I thank you for the Roseland community and all of the things that are happening there at the hospital and in the community centers. Lord, thank you, because we desperately need help in our communities. And so, Lord, thank you for those who will participate today and help us to raise the awareness and raise our consciousness around our own health. Help us, Lord, to take charge of our health and not just allow health providers to tell us, but to really do the homework ourselves so that we understand this is our body. And so we need to do things to protect ourselves. And we know our bodies. So help us, oh Lord, to understand how to take care of ourselves and also take care of others. And Lord, we invoke your presence into this place today that we might be educated, empowered, but most of all transformed. In your name we pray. Amen.
Thank you, Pastor. Please realize that our work is critical for addressing long-standing health disparities. And I am proud to introduce our fearless leader and project manager, Ms. Teresa Woods, who birthed this project and will walk you through the future of what REACH will look like on Chicago's far south side. Thank you.
Thank you, Rochelle. I think I'd be remiss if I said I birthed the project, because this is actually the brainchild of some of our fearless leaders sitting in these first two pews, who I will soon announce. But once again, thank you. Thank you all for being here today. During this time, I will inform you all as to what REACH is. I'll give you a little bit more as to what REACH is, our current initiatives, our developments, and what this will actually mean for the community. So what is REACH? Our mission as REACH is to provide compassionate, community-driven health care to the far south side of Chicago by utilizing collaborative partnerships to transform and overcome systemic challenges. Our vision is to be a cornerstone community resource recognized for driving excellence in patient care, health equity, and innovative solutions that enrich the well-being of our thriving population. The areas that we serve on the far south side are Auburn Gresham, Avalon Park, Beverly Burnside, Chatham, the Greater Grand Crossing, Morgan Park, Pullman, Riverdale, Roseland, Washington Heights, and West Pullman. And right now, I want to acknowledge our REACH Collaborative. Again, REACH is an HTC of the following entities: Roseland Hospital, being the anchor hospital, TCA Health, Christian Community Health Center, Chicago Family Health Center, Beloved Community Wellness Center, the Women's Health and Development Foundation, Maryville, and HRDI. I also want to acknowledge REACH's leadership. We have our board chair, Rupert Evans, Dr. Rupert Evans. If you don't mind standing up as I call your name. We have Timothy Egan, who is our vice chair and the CEO of the new Roseland Community Hospital. We have Eugene Humphrey, who is our treasurer and who is also the executive director of HRDI. We have Ms. Sherry Pace, who is our secretary and who is the CEO of Chicago Family Health Center. We have Veronica Clark, who is the CEO of TCA Health. We have Margie Johnson, who is the CEO of Beloved Community Family Wellness Center. We have Kenneth Burnett, who is the CEO of Christian Community Health Center. We have Nina Alaprandy, who is Associate Executive Director of Maryville. And last but not least, we have Joseph Harrington, who is the President of the Roseland Medical District. If you all don't mind standing, our leadership might not be here, but we do have representation from them, so they can all stand. So our community needs assessment. Based on a 2022 community needs assessment conducted, behavioral health and access to maternal resources were ranked high in terms of unmet needs in the community. This has prompted the initial direction of REACH's impact. Our REACH initiatives for OB, it's increasing access to the use of prenatal care appointments. We also look to increase the identification of pregnancy-related complications. We look to increase the mental health and behavioral health referrals. We look to improve Roseland Community Hospital's quality metrics, in addition to increasing their patient satisfaction. And last but not least, we look to increase the access and the use of postpartum follow-up appointments. In terms of our behavioral health initiatives, sorry, can you all not get a little closer? Can you all not hear me? You guys should have said something. Now? Okay, now it's a little better? Okay, good, okay. In terms of our behavioral health, REACH is looking to decrease those readmission rates. We're looking to increase medication adherence, and last but not least, we are looking to increase that 7 and 30-day follow-up visit with primary care providers and behavioral health care providers. All right. In terms of what we're doing major or large-scale wise, so REACH will be taking on 3 major construction projects within the span of 5 years. We are, 1, developing 2 residential homes in the Pullman area, 1 for adolescent psych and the other for high-risk mothers. And last but not least, we are looking to totally renovate the labor and delivery unit at the new Roseland Community Hospital. That's a big thing. I think that deserves a round of applause. And I do apologize, it's a little hard because I had a lovely PowerPoint presentation for you all, but that's okay. We're still gonna work with it, right? Oh, it's up there? Oh, okay, wonderful. I didn't see it, it's not right there. Okay, so first let's address the Center for Adolescent Sustainable Healing. This is gonna be our adolescent psych residential hall. This program includes converting a Roseland Community Hospital-owned building, actually 2 of them, on the north side of 111th Street into 2 6-bed gender-specific floors with accommodations for non-binary youth or healing centers to safely house adolescents who are experiencing behavioral health and social changes, including housing instability. Maryville Academy will develop a plan for the staffing model, and residents and RCH will employ that staff. Our FQAC partners and HRDI will refer those adolescent program participants. Patient will obtain ongoing primary and behavioral health services from our FQACs and HRDI as needed. The collaborative will obtain commission and accreditation for rehab facilities, that certification, and any type of licensing from DCFS for the residential facility. Roseland Community Hospital will galvanize a comprehensive referral network, which will ensure continuous capacity for both female and male residential units. These adolescents will undergo regular counseling provided by the staff, such as psychiatry, counseling, mental and behavioral health professionals, in addition with working with our collaborative partners. In terms of our maternal residential housing, affectionately called the Maryville Moms Maternal Health Program. Is that up there? No, it's not. Okay, this program will be designed and ran by Maryville Academy. This building sits on the south side of 111th and State Street, and this building will be converted into a 7 to 10 room residential home with the capacity to serve 15 to 25 pregnant women annually. This facility will be large enough for our pre- and postpartum moms to share with their newborn and potential siblings. This residential unit will operate on a 24-hour basis, 7 days a week. And again, this will be a program and facility solely run by our partner, Maryville. And what I'm most happy about, talking about our improvements to our labor and delivery unit. So the hospital's OB unit will be transformed to address the ongoing healthcare challenges and inequities of our communities. Roseland Community Hospital will provide the community a totally rehabbed facility with patient upgrades, new marketing campaigns, and additional mother programs for our mothers in the community. All right. So what you all don't know is that, again, this has been a long labor of love, right? We just completed, I'm happy to say, our first year, but this, again, has been in the works for far beyond that. I want to say it's been going on for 5 years now. And again, Rochelle affectionately said that I am the leader, but it is not. I can't, I'd be remiss if I didn't say that Tim Egan has been the one who has spearheaded this project and fought for this project for 5+ years. So again, thank you for that. And us, my team and I, we're the ones who are just leading the charge. He's already paved the way. So with that being said, yes. So with that, again, we have just completed our first year, praise God, and we have accomplished a lot. So again, as you see, we have a lot of partners. We have tons of partners. We have tons of community-based organizations that we work with, and we would not be here without the support of those partners in those community-based organizations. We have, yes, that deserves a round of applause too. You know, we have enhanced the access to quality prenatal and postpartum care in this year. We've also expanded our behavioral health screening process. And on top of that, we have increased culturally responsive outreach and education. And last, we've strengthened referral pathways and our community clinical linkages. So as I wrap up, you probably want to know, what does this mean for the community, right? REACH will transform the health and well-being of Chicago's far south side by utilizing trusted hospitals, healthcare centers, and community-based organizations to address those poor health outcomes that we are currently facing. by expanding out access to quality care, improving those maternal and behavioral health elements that I previously spoke upon, tracking barriers like safety, education, and support services. REACH means to bring hope to the community, provide a healthier future for those families who have historically been underserved. So with that, that was a very brief run through, but this is a community town hall, right? So with that, I'm going to open it up to questions from you all. I want you all to please, if I can clarify anything with our initiatives, if I can give any further explanation as to what we're doing. It will not only be myself speaking, but I have this lovely panel. I have my community, our clinical nurse navigator, Ms. Sylvia DeBerry. I also have my RN case manager, Ms. Kim Ingram, and our wonderful doula at the hospital, Ms. Valencia Green. Okay. All right. Guys are a quiet bunch. Any questions? Oh, yeah, there's a microphone, and I'm sorry. Any questions, you guys can come to the aisles and speak directly into the microphone. Okay. Thank you.
I'm Julia Picard of DCH Health. I'm a behavioral health community health worker.
Thank you.
All for me, right? With that said, are you all thinking about maybe incorporating an initiative with PFAs, which is psychological first aid responders, considering that it's enrollment, the capacity of shootings and death and things like that? I think that area would be a great area to integrate something like that, and this program sounds like it's a good fit for that.
Yeah, so again, this is why we have our amazing partners like TCA to collaborate on things such as this. So again, this project is for 5 years, but that is not to say, and I'm sorry, let me take a step back. Our focus is behavioral health and maternal health. However, that is not to say that things change within our community, right? So we have town halls like this for us to gauge, okay, are we going in the right direction? Do we need to pivot our initiatives? Do we need to focus on something different? So yes, as you said, maybe something, a program such as that needs to be implemented and incorporated so we can further address the needs of our community.
Hi, good morning. Thank you so much for this information. It's so important to me. My name is Diane Smith. I'm a retired family nurse practitioner and faculty member. But I worked with a community group on the west side years ago in the Austin community to try to really increase the quality of access to health care. And what you're doing in the Roseland community, oh my goodness. But my question is that sustainability. You know, you can always have great guns starting out and everything, and that was our problem, sustainability. So I'm just wondering how it's set.
Looks like, yes.
Yeah, with
As
this
my
program.
partners look at me and hold me to that, yes. So we definitely are working on that, as you know, or as I stated before, this is a HTC. So this is a grant-funded program. It will be funded for 5 years. However, myself being the project manager, I'm working very diligently to make sure that we sustain this. As I've heard from you all, this is necessary. As we all know, all of these programs are necessary for our community. Very necessary for our community. So please know, this is my promise, my commitment to you all, that I will do my best to make sure that this programming remains in this community. We are currently working with other entities, other community-based organizations, looking to corporate sponsorships, things of that nature to ensure that we have the funds that we need to carry on this programming as of now. It definitely is. Please, Ms. Petit. Huh? So again, we have that government funding for 5 years, and we are looking for other government resources. But we want to step away from that because we all know that, grants come and go. Those who work in public health, here one day and they'll snatch them the next day. So of course, you know, we don't want to put all of our eggs in that basket. We want to, again, look at other resources to sustain.
And then if I could just add on, as we all sit here, right, sustainability starts with awareness, right? So in order for us to sustain every method of our KPI initiatives, it starts with awareness. So the more the community is aware of what we're offering, what we have to bring to the community in itself, to our patients, to our moms, to those behavioral health patients that we are serving within our hospital, the more that information flows, right? And so they're able to speak about their experiences at Roseland Community Hospital, share that, spread that, having all of our partners here today, having everyone who is a part of this initiative, whether you're a partner, a patient, an advocate for healthcare, retired nursing practitioners, professionals who become a part of this initiative and help us to spread the word. That is where our sustainability starts. It starts with awareness and getting it out to our communities too.
And just to piggyback, the reality is we are working with our MCOs. So you got to know that this program is just a stepping stone. If we steer things correctly, if we really steward this opportunity that we have to bring these resources to the far south side, then as we work with our MCOs and everyone, every provider knows about the HEDIS project and those quality measures that we have to meet to continue to bring revenue into our healthcare systems. So this is a great opportunity to kind of get the infrastructure right, to build upon that as a collaborative, to strengthen the organism, the healthcare organism on the far south side, and then to really close those gaps in care so that the revenue can continue and we have that sustainability. Now that is real.
Good morning.
Good morning.
I noticed that it says Roseland, but in the slide, it showed different communities, like
Yes,
the
ma'am.
Auburn Gresham,
Yes,
Morgan
ma'am.
Park.
Mm-hmm.
So I live in the Auburn Gresham area, so what I'm thinking, when I see Roseland, in my mind, I'm going to think that's specifically for that community. So maybe it should be expounded upon that it's not just Roseland, it's,
definitely.
you know, Auburn Gresham and Morgan Park and all these other, Chatham, all those areas. And I think that'll help to bring more people and, you know, awareness.
Definitely, I will note that.
Amen.
Thank you, ma'am.
Good morning.
Good morning.
My question is, because I know you get a lot of patients there who are mental. And I know all the hospitals do. And I know the mayor is talking about opening up, you know, because they're all on the streets. They have nowhere to go. So what do you do with them when they come? I know you don't have you can't keep them there forever.
We don't.
So,
We do not, and we do definitely do address our mental health patients in the Roseland, West Pullman, all those communities. We have a very robust behavioral health unit. Is our behavioral health manager is here? Yep, I'm going to call you out. Nikki, if you don't mind standing
yeah,
up.
see, a lot of them are losing their lives because they get into it with people, and because they've got these mental issues, they're not recognized. Not even by the police, and they should know when somebody is mental because they've had the classes. But we have a problem with that. And it's just not, it's all over the city, it's everywhere.
It is, yes, ma'am. Yes. But to address that, yes, we do have, again, a very robust behavioral health unit. On average, we see in a month span almost 90 to 100 behavioral health patients who are treated and discharged accordingly within reach within these fabulous partners that we have. So not only are we treating them at the hospital, we are sending them out, again, strategically to HRDI, to TCA, to Christian Community to address their needs. And the whole preface of REACH is to be intentional about those patients that we see and make sure that they are successful in their recovery process. So it's not a one and done. We don't just see them and discharge them. No, we are making sure that they are put, together with community health workers who are addressing their needs, that we have RN case managers that are coordinating their care. Again, because based on the KPIs that we have, we want to decrease that readmission. We want to make sure that those patients are getting their meds, taking them, accordingly, making sure that we are addressing their social determinants of health, right? If there are any obstacles in their way to address their care, whether it be housing, food insecurities, things of that nature, that we're addressing them and making sure, again, that they are successful in their recovery.
And let me add, we do have a great staff of social workers who also work with our BA's population. And so many times we're getting those compliments from the patients that, hey, I really like how you've treated me here. You've treated me like a person, and most places don't do that. We had just last week 2 or 3 special compliments. We had one patient that just insisted on giving us donuts because he was like, oh my God, you guys did such a great job and I feel so much better, and just thank you for the care that you're giving. So just know that Nikki's unit is doing a very good job, and she really allows her staff the freedom to be creative and comfortable in dealing with the population that we serve.
Something that's very important to me. I haven't heard anything about senior services.
Senior services. So again, yes, the initiatives for REACH are maternal and behavioral health, but again, this is why we have our town hall. So if there are issues pertaining to, our elder population that need to be addressed, please, now is definitely the time. We can definitely incorporate that into our plan of work, into our initiatives to make sure that we are addressing those needs.
I promise this will be my last question.
No, I love questions.
And/or statement. So one, again, congratulations to you all. This is amazing. I do have one question is, where exactly are your locations for your services? Because I know you partnered with us with TCA, and we're in Chatham and Hegewisch and Argyle Gardens, et cetera, now Hammond. And with us not initially being in Roseland, but we're right at the cusp of it, it's still a good overlap. So one, where are the locations? And then the second thing I wanted to bring up is next month, October, is Mental Health Awareness Month. Yay. So I'm sure you guys have some initiatives going on already in place. We do too, so I would like to overlap with that if possible to make it even bigger. And our reach is to the seniors, so we can even incorporate something like that with REACH and REACH. Did I say REACH twice? That's funny. To really expound, because again, this is amazing, and not every area is doing this, and we can expand even further to South Shore. And also, I just saw just a lot of demographics that are kind of overlapping with us and you all, so I would love to talk to you later, but let's put that out there.
And so to answer that question, so yes, most of our services are out of the hospital. However, we do have opportunities where we do partner with our partners and have that programming at their facilities. So we're currently in the process now, and I don't know, I'm putting you on.
Also,
Okay. I was going to put you on the spot, Sylvia, to talk about our maternal health, programs that we have.
I wanted to address the senior services.
Oh.
We also partnered with Blue Door, which is Blue Cross Blue Shield. We attend almost all of their events relating to nutrition, maternal health, and senior services. We have a really strong connection with them in regards to referring patients and referring any community, any community leaders or community organizations surrounding the senior population. So you can also get information from myself before you leave here. to kind of connect with them. They have an email service where you can sign up for it utilizing their QR code, and those services will be provided for you as well. You don't have to be a Blue Cross Blue Shield recipient in order to take advantage of those community events that they host at their locations. And they are both in Pullman, in the Pullman area, the Morgan Park area, and Lawndale area.
And you can just walk in. Just walk in. They have a calendar of events available. And you can, if you're a senior, you can just walk in and you'll see all the activities. They give out food boxes, fresh vegetables. I even went on the Heart Walk that they have. They have the jazz events for the seniors. Just plenty exercises, yoga, everything. So please walk into any of those locations and just get a calendar and talk to them. They'll let you know what's available for seniors in that area.
And also at Roseland Community Hospital, we have events for seniors. We've hosted senior bingo. We have a community organizer. Her name is Somika. She does, I think, 2 to 3 annual events with seniors at Roseland Community Hospital. Please feel free to walk in, come to that front desk. You can either ask for her information or more information on those events that we host specifically at Roseland Community Hospital if that's in your area. No problem.
Please note our partners may also have additional events for our seniors as well.
Good morning, I'm Deborah Crockett. I'm a clinical social worker. I would encourage the organization to consider non-traditional forms of therapy, art therapy, music therapy, dance therapy, and group work because it's important. I'm also a breast cancer survivor, and thank you. Gilda's Club has partnered with Christ Hospital, and they offer those kinds of things for cancer patients, survivors, etc. So that all of those things, we work in concert. We're mind, body, spirit, and as much as we can nourish those things, and I've also found in my private practice, incorporating art, incorporating music, incorporating movement helps with their mental well-being. So.
No, that's definitely an important point. Okay.
Sorry, I'm in the middle. So 2 things, and kind of spearheading off what she was stating. I was also thinking about cultural competency when it comes to these women, and also bilingual services. They play a very big role, and so I just wanted to make a note about that as well, because, you know, it's essential when it comes to like health, and sometimes people feel more comfortable with like herbal medicine and stuff of that nature, and so kind of like when we're looking at different therapies as well, but also thinking about like cultural competency. That's all. Thank you.
Thank you. And I don't want to misspeak for my partners, but I know Roseland is very culturally competent. I know that is part of our training on monthly, quarterly basis to speak to that. We definitely want to make sure, hopefully you can all hear me, we definitely want to make sure our patients are comfortable, that we are not providing any barriers for them, language-wise or anything. So yes, we definitely take heed to that.
Well, since I got the mic, I guess I'll ask the question. Good. Is it morning still?
It's still morning, girl.
Okay, good morning. My name is Sharon Batiste. I am with TCA Health. I'm a licensed navigator. I do outreach, and I help people, assist people with their health insurance, whether it be Medicaid, SNAP, or Marketplace. So how does it go for the program with insurance? Do you accept people with insurance, or do you help them get them? Like, what role does that do for insurance?
So yes, as our partner, you should know that, yes, we do definitely lean on you all when we talk about patients without insurance. No, we don't turn away anybody. Roseland is a safety net hospital, so all are welcome, insured and uninsured. When we are faced with those patients that are uninsured, we have community health workers at the hospital who are diligently working to get them signed up. In addition to our community health workers, these lovely ladies up here are also doing it as well. They are making sure as we are getting them, and that's all part of the social determinants that we're assessing all of our patients for. Again, we're making sure that they are insured, that there are no food insecurities, that there are no housing insecurities that our patients are facing. And again, we are leaning on our community health workers and our partners who have lovely navigators to get them the necessary services that they need.
Hello, everyone. I'm Yaya, the doula. When you speak regarding the insurance, what we, especially Sylvia and I, because we work very closely with the moms, we are intentional about making sure moms know about their benefits. When I say, and we are intentional about our moms getting WIC services the moment we know they are pregnant. We're so intentional, we get on the phone. What we have found out is moms under 30, they do not like the phone. They don't. But if you put it in an app, they will do it. But to get on the phone, it's a no-no. And I've seen it personally where a mom is anxious to get on the phone. And so I sit with them. We're going to call them now. No, I'm going to call them when I get home. I told one young lady, no, I don't trust you. We're going to do this now. And I sat there and I said, make the call. I'm going to sit here. If there's a question that they ask and you're feeling anxious, just look at me and I'll help you. And I did, and we got the mom an appointment. So we just don't say, here's the information. I have another story with Sylvia in transportation. We had a mom on a unit. She needed her baby got transferred out, and she needed transportation. And the insurance company provides transportation, but you got to call. And this was a unique situation. Sylvia was on the phone with the transportation coordinator for the insurance for like an hour, got to the upper management and said, you're going to provide this transportation. This is a unique situation. We don't have 48 hours to wait. This mom needs to see her baby today. And we got it done. And so that's another part of what we do. We are intentional about making sure that our moms know this information and get it out to them and show them how to use it. Because you can give a person a fish. No, me, I want to teach you how to fish.
And just to piggyback off of what Yaya is saying, essentially these insurance companies provide these moms with a lot of resources and benefits that they are unaware of. So what we do is once we kind of assess their social determinants of health needs, based off of what they specify their need is, we try to find every loophole, every resource, every organization that we can in real time. So it's not, oh, we've assessed your social determinants of health, on your next visit, we'll figure out what we can do. No, in real time, we sit with each patient that we assess at every visit during their referral process or OB intake process. We sit with them and we go over these social determinants of health needs, be it transportation, food services, housing. We partner with a lot of different organizations just to ensure that there is a smooth transition for these moms when they need these resources. We partnered with New Moms. We partnered with Youth Moms Chicago for our youth moms that we see in our clinic areas. We partnered with Aetna Better Health, Blue Cross Blue Shield. Now we have taken a few trainings with Molina and Meridian Health, just to ensure that we have the knowledge and the education to further educate these patients, because we don't have these insurance providers at liberty in our hospitals, right? So we have to be educated enough to get that information out to our patients. And I can tell you 90% of the time, patients are unaware of these services that are their benefits, right? It is their right to take advantage of these benefits. These insurance companies, especially for moms, they have well mom programs that issue moms car seats, bedside cribs, breast pumps. These are things that we ensure that they have when they come to our clinics, right? When they come to our hospital. And even if we get them through the ED and they go to the labor and delivery department, we assess those social determinants of health. So at every step of the way, when a patient is referred to us, when a patient comes through our doors, that is our priority. Assess social determinants of health, also conduct a perinatal mental health screening to ensure that we are able to provide those resources in real time at the time of their visit so that we don't miss these patients. We don't always get them in the first trimester, right? We don't always receive our moms through the EDs where we can allocate them to a prenatal or OB provider. We may get them at delivery, but it's still our job to ensure that those needs are assessed so that by the time they leave our hospital, they have everything that they need. We partner with Every Mom Chicago to provide our moms with a slew of resources prior to them being discharged from our hospital. That includes peri and postnatal resources that those moms need. We provide them with a baby tub that is full of clothing items, diapers, wipes. All of this is free, right? This goes home with those moms, and sometimes it allows a mom to be worry-free for that first 3 to 4 weeks at their postpartum. We also partner with an organization that does home health, and that is Chicago, not Chicago Family, Chicago Family Connect. Yes, Chicago Family Connect. We've partnered with them now for over 2.5, almost 3 years. They provide our postpartum moms with services that go beyond the hospital, right? So once that mom is discharged, they follow the mom through for that 6 to 8 weeks, and up to a year, they provide services for those moms postpartum. So again, as everyone has said here today, we are very intentional on the resources that we provide for our moms and ensuring that they have everything that they need when they get to us and prior to them leaving.
Hi, yes, my name is Virginia Julian. I'm a retired nurse, and my background was maternal child health. And I know we talk a lot about moms, but I've not heard anything mentioned about fathers and services that are available for fathers as well. I had the opportunity to interview moms and fathers across the state of Illinois, and one of them said, hey, they don't talk to us, they don't ask us anything, so where are we in this denominator? So I just want to ask on behalf of that.
So we definitely include our dads. I tell our dads all of the time, this visit is for you as well. And we do that just so that, you know, a lot of times during pregnancy, I don't know how many of you all have actually been pregnant, but you get pregnancy brain, right? And so you don't always remember things that are discussed in an appointment. You don't always remember the things that you would like to discuss with your provider. So I'm always intentional when speaking with birthing families, right? I even refer to them as birthing families when they come to the visit, because I want to ensure that the dad that knows that he's just as valued as the mom in this process, mainly because they are the person that is not going through, right? So even in the birthing process, the laboring process, the dad is really not going through as much as the mom is, so they're more acumen to respond or to remember things that the mom may not remember at that time. We also partner with IOPQC. IOPQC is an initiative that is statewide that we partnered with now for about the same amount of time, about 2 years now that we partner with them. They provide us with resources for our dads as well. Also, we have birthing classes that are tailored to both our moms and our dads and our grandparents, right? Because we tailor it to the support person. It may not always be dad, it may be mom, it may be sister, it may be grandmother, it may be aunt. So we tailor all of our education to birthing families. When they come to the clinics, regardless of who they come with, sometimes it's with their doulas. Sometimes it's with their best friends because we have younger moms. We tailor our education and providing those resources to the family. We ensure that if the dad has questions related to this entire process, that we answer those questions. If mom and dad are uncertain about the decisions that they're making throughout this laboring or birthing process, we make sure that we educate them to our fullest extent. And if we can't provide that education, then we allot them with resources and support groups.
I will say, with delivery, my Dr. West, she is very intentional who the partner is in delivery. Our doctors, they do include the dad. Like, they'll say, okay, get the dad dressed. It's time. Dad, they don't ask the dad, do you want to cut the cord? They tell the dad, step over and cut the cord. And that means a lot to our dad. I was supporting a family, and Dr. Ramsey, after the baby was delivered, Dr. Ramsey went into the room and gave the dad a hug and said, you did it. And I was like, oh, and that dad felt really, really supported. So our doctors they include the dad, or whoever the partner is. Sometimes, as Sylvia said, it is the aunt, but they allow them, they want them to come in and be a part and see birth is beautiful. It is hard, but it's beautiful. And a lot of the partners, when they see the baby being born, it changes their mindset. And they become soft. I've seen a dad break down and cry and then almost pass out. But, but yes, we don't say like, oh no. And again, as Sylvia said, it is the partner. It's not just the dad. It's whoever their support person is who we will. And we feed support people. After the baby is born, the support person can actually go to our cafeteria and get a meal.
I can also say that our physicians are very intentional with our social determinants of health. They will ask us if we provided our patients with everything that they need. They are they are also very intentional about the referral process, right? What are we doing with this mom now that we're discharging her? Do you all have a plan? And I can say specifically, Dr. West, she is here now. She has called me on the phone like, hey, we got this mom, we're about to discharge her. She's so-and-so amount of weeks. What can we do for her to ensure that she has the, correct referral process, that she has all the resources that she needs? Is there anything else that we need to get from this mom? Any additional information? So our physicians have really come along, and even with our perinatal mental health initiative that we've just rolled out with IOPQC as well, we have another physician that has jumped on board as our provider champion. And she's very intentional about getting those resources and assessing those moms appropriately for mental health.
Oh, can I just add, our partners, please know that that connection to our partners that are part of the HTC, this is a fluid back and forth referral between our partners and ourselves. Us being the hospital aspect of it, but we're trying to make sure that as an HTC that we collaborate with all of our partners within that HTC to highlight all of the resources that they have and the great care that they're giving, and that we support each other within this HTC. So it's not just Roseland. Remember, we're building a healthcare organism on the south side, and it's going to take all of the parts of the HTC to do that. So please know that Our partners are right there beside us, in front of us, on the back of us, and we're the same way with them. We're all working together to better service folks in our communities.
And also to our partners, we get your referrals and we have been doing our due diligence to send them back. For whatever reason, our moms come to us and they don't realize that their referral is for a maternal fetal medicine physician. So we often have to remind them, this is not your last stop. You still have to complete your OB visits. You still have to go back and see your OB. Oh, I thought I was being transferred to this hospital. No, ma'am, this is a collaborative effort. You see us, you see your OB provider, then you come back to us, and if you deliver with us, you still have to go back and see your OB provider for that postpartum visit. And so it's so very important that we continue this work because it's going to take both sides, right? Us letting them know how important it is to return to you all, as well as you letting them know how important it is to keep up with those high-risk visits, right? Because it takes both. It takes both. We may miss something that you guys may catch, and vice versa. So we rely heavily on you all, not only just for the referral process, but just ensuring that that patient is cared in its totality, right? From the start until the end. So you guys are valued. We appreciate everything that you guys have been doing in connection with us as a hospital, as an organization, and we are ready to see what year 2, 3, 4, and 5 will look like as we continue on with this collaborative project.
Does everyone know what a doula is? Is there anyone who does not know what a doula is? Okay. So, a doula is nothing new. The actual word doula is new. I am not a midwife. I am not medical support. I am the added value to pregnancy, birth, and postpartum. What I do as to support pregnant family, I am the pregnant family best friend. That's a term I came up with. When mom or whoever is feeling like no one is listening to me, then they call me and they say, oh, I don't feel good. I know, Pumpkin. You probably need to drink some water, Pumpkin. Pumpkin, when the last time have you eaten? I haven't. The baby is hungry. Feed the baby and drink some water, and I'll call you back in an hour. But I'm there to support, to answer questions. And some of them just want to call and vent. My feet hurt. I know, Pumpkin. You'll be okay. Put your feet up. So that's the support. Now, in birth, I am there. I do not have to necessarily go in the room, but I can be there. During the birth, when you're laboring, I'm there supporting everyone. Okay, Pumpkin, I know you don't want to do this, but you got this. You can do this. And then postpartumly, I can go to the home and spend time with them. When I walk into the home, I have 4 questions. When is the last time you have pee-peed in the potty? When is the last time you have taken a bath or shower? When is the last time you have eaten? When is the last time have you slept? And they say, oh, I've done none of that. Okay, give the baby to me. We gonna hang out and talk about how he or she feels now that they're outside. And then you're gonna go take care of yourself. Because our Black moms need so much support postpartumly. That's where we lose them, because they're taking care of the baby and not themselves. Everyone comes over, the baby, the baby, the baby. But what about the oven that baked the baby? The mom needs help, and that's what a postpartum doula does. We help with breastfeeding. I know, mama, it's hard, it's uncomfortable, but you got this. Okay, let's try a different position. I'm not producing enough. I know, mama. Stay off TikTok. Stay off YouTube, Facebook, social media, because everybody is not going to produce a gallon of milk a day. And some of that is just hype. Mama, God and nature does not quit on you. Anything God created, he protected and he fed. So it's okay. I know. Let's do this. Mommy, show you some grace. I'm hungry. Okay, let me go in the kitchen and make something to eat for you to eat. So those are just the things that doulas do. Now, doula services are unique. Everybody does not doula like Yaya. And Yaya doesn't doula like everyone else. So I don't want you to think like, oh, well, this doula did this and you didn't. Doula services are unique. And at Roseland, the doula services are FREE. So I can support. And there is no charge to the mom. We also, thanks to the grant, we have a training car seat. And so now, because I'm certified through IDOT services, I train people how to put their precious gem in the car seat, because we do not put our babies in the car seat correctly. I see it all the time. And then I train, how do you put the car seat in the car? Because that is a workout. It takes a lot for you to get used to it. It takes a lot. So that's one of the newest things. I was able to get a chair for training. So I take the chair into the mom's room and I sit there, mom and support person, let's do this. And we'll soon be adding classes where we'll have the community come in and learn how to put our precious gem in the car seat and then the car seat in the car.
Aside from that, we also offer safe sleep education, which is another huge initiative that we've taken on as a OB unit. This safe sleep ensures that all birthing families are educated with safe sleep by the time they're discharged from our hospital. We also partner with Lurie Children's Hospital to ensure that they have a pack and play safe sleep crib, bedside crib to go home with them as well.
Are there any last questions before we wrap up? No?
Hello, everybody. I'm Nikki. I'm the Behavioral Health Manager at Roseland Hospital. I just want to quickly say that Roseland also has partnered with 111 police station, because I know there was some concerns about that. So instead of them taking these patients that's having a mental health breakdown to jail, so to say, they are bringing them to us now to treat their mental health. Not saying that the police not going to come back and get them after this day, but they are coming now to be treated. Also, to the seniors, we have now opened a medical psych hold site where we have 6 beds. So now those that cannot lay flat, like on the mental health unit, we can't have ligature, so we don't have like outlets with people that maybe experience COPD, need IVs. So now they can go on the medical side and not only get their medical needs treated and be comfortable with the head of the bed, where they can sit up in the bed and they're not laying flat. We can also treat their medical and mental health needs, okay?
Well, thank you. So, I'll have my last comments, but, I want to give it to any of our partners who want to provide some, comments to the community. No? Muriel, go ahead. Vivian? And please state where you're from so they all know. We're just going to go Vivian.
Good, Jesus, be offense. Okay, I'm sorry. Good morning, everyone. My name is Vivian Dean. I am with HRDI, one of the collaborators with this phenomenal program. I want to speak on in terms of mental health because we don't see a lot of the pregnant women in our facilities, but that does not mean that we do not support their mental health. So generally with Roseland and the referrals that we get, we do supply them with the behavioral health needs they need on an outpatient basis. This is not a 6-month program or 3 months. This is as long as they have a mental health need, they can come to us to get those particular services met. Not only for the mothers, but just people in general. If you have anyone out here in your families, in your communities that are in need of assistance with their mental health, we assist with medication. Dr. Shaw, who's on 113th in Michigan, is a great partner for us in terms of making sure that the patients have their medications at all times. We have Mobile Crisis. We do have a representative here for Mobile Crisis. Mobile Crisis is 24 hours because mental health doesn't stop. So we do have numbers, we have resources where you can contact us at any given time of the day and say, hey, either I have issues or I have someone here with issues that is in need of help. Our Mobile Crisis team comes out, assess the situation, get the person hospitalized if need be. We also will offer them outpatient resources. We do have facilities that house men and women. For substance abuse treatment, there's an inpatient. Generally, it's a 28-day program for them to come and get all the way clean throughout that time frame. And then after that, they're referred to outpatient services or groups, individual therapy. All of that is supplied to the client. Methadone medication to make sure that they are trying to stagger their way off of their drug of choice. We have outpatient but inpatient mental health residential programs as well, where people who family have shunned them, because we've seen that, homeless individuals who have mental health needs, they can come, they can stay with us, we help them get on their feet, we make sure they're taking their medications, and then we help them prep, because a lot of them have Social Security. We help them prep for the outside world, and even when they leave our residential program, they still have our services to fall back on in case of anything. So, Jesus be offense, my brain. It's Saturday morning, y'all, I'm still half asleep. But HRDI has been in the community for over 50 years at this point. Dr. Bateman was the start of our show, and now we partner with Friend Health, who is our parent company. They're also a medical facility. So we're just not treating the mental health. We have a holistic point of view working with CCBHC. We're doing the different things such as the music therapy, the art therapy, any component that is needed to get through to the clients at their needs. We are touching on that in every type of way. I think that's pretty much it that we do. There's a lot of other stuff, but you guys come visit us, 33 East 114th Street. Yes, the staff there are very caring. And one thing that I do, I work for the quality, I'm associate quality director, and I'm also a trainer for the company because I've been with the company for 12 plus years. Started in as a mental health clinician, going into the communities. We don't limit ourselves to the clients coming to us. We meet the clients where they are. So if you say you want to meet us on 51st Street underneath the L, we on 51st Street underneath the L with you. We're also now about to start our telehealth initiative where you don't have to download an app. All we do is we assign you an appointment, you'll get a link to your cell phone, click the link, you are now linked with a mental health professional that can help you at any time of day. So those are things that are coming with HRDI, the telehealth. We are excited about it because a lot of people don't want you in their house, but they still have mental health issues. So this will reduce that barrier of contact with our particular clinicians. Other than that, that's pretty much it.
Oh, well, she forgot one. She forgot one, and I had a personal, pleasant experience with one of your staff on the BHU unit. And they were coming, the caseworker was coming to follow up on one of the folks that were hospitalized at Roseland. And HRDI came, that caseworker came on the floor to figure out, hey, how did you wind up back here? Because this was your client you were working with. And so I can personally witness the fact that you followed them all the way through to say, okay, you had a little setback. Let's figure out how to get you back on your feet. And that is a great example of the collaborative and how Roseland, BHU unit, and HRDI and our partners are working together to service the client, the patient all around. So thank you for that.
And to piggyback off of that, because I totally forgot about our PAS team, those PAS teams are in Jackson Park Hospital as well as St. Bernard Hospital. So we're not only partnered with Roseland Hospital, so that when clients are seen in the emergency department, because when it's cold outside, they go there a lot, we're contacted by their PAS team for not only our clients that are being hospitalized for mental health issues, but as well as potential clients, so that the clients don't have to utilize the emergency department for shelter, for medication, for care. We are there all the time. The PAS team works 24 hours a day, so as long as we have somebody there, those particular people will be linked with services so that when they do leave the hospital, they have a safety net that they can land on. And anything that we cannot provide, we don't hoard it to ourselves. We make sure that the client has everything they need down to housing. And a young lady did speak on the police earlier with mental health. The city of Chicago has a CIT program, for those who don't know. So when you encounter a person who maybe experienced a mental health episode, you always want to contact 311, or if you contact 911 because it's an emergency purpose, please let them know a CIT officer is needed on the scene. The CIT program within the Chicago Police Department, which was spoken on, where they're partnered with Roseland Hospital, they help de-escalate the problem because they understand the symptoms of mental health. They understand what those symptoms look like. And a lot of time, our mental health clients, they cannot speak for themselves when they're experiencing an episode. So having someone on the Chicago Police Department that comes out and say, hey, okay, and understand and be calm with them and not escalate the problem, it creates a safer environment for all our mental health people, where they're not running when they see the police because they know something will happen to them or could happen to them. But so please, when you encounter people with mental health and you feel like 311 or 911 is needed, always ask for a CIT officer to come out on the scene, and they will help de-escalate the situation. Okay, now I'm done for it.
Another thing, which we can't really advertise it like we want to, but we have often, sometimes moms and babies that have been exposed to drugs. When I tell you we love on these babies, I call them lovables, where the first time I experienced it, a baby was with us for about a month, but everyone on the unit held that baby. Everyone on the unit was like, this is my baby. Everyone was excited to love on this baby. And that's what we do at Roseland. The nurses take in the nursery, they take care of the lovables. and they get them weaned off so that they can go where they need to go. And I mean, they are holding the baby. We have a carrier. We have the momager swing that does that, the mama rule. And so we do that, but people don't know we do that. And so we love on these lovables. Everyone. And it's a beautiful thing to see. So that's the type of care we provide for our moms and our babies.
So good afternoon. I know we're winding down, so I'm going to keep my comments brief. I'm Dr. West. I'm the chair of OB at Roseland Hospital, and I want to say thank you to Teresa for providing this forum. And thanks to all of the comments at a town hall. We want to hear from the community, so we are listening, and we want to hear what you have to say as we try to transform our community. I am a product of the Roseland community. I've been on staff at the hospital for 23 years and have been the chair on and off for that entire time. I'm so grateful to be a part of this transformation. I believe that the women that come to Roseland Hospital deserve the same wonderful care that women across the city receive. And that is what we're all here for. As the anchoring hospital in the REACH transformation process, it's my responsibility as the chair of OB to make sure that any woman that comes into the hospital pregnant, intending to get pregnant, or postpartum receives first and foremost respectful care. So many of our patients believe that because the hospital has been in the state that it's been in for so long that they're not going to be treated well. And so our first goal, and we had a wonderful respectful care breakfast that Teresa did, that's Sylvia, I keep calling you Teresa, a year ago. We start with respectful care, behavioral health, OB-wise, throughout the entire hospital. And in this moment where we have at least been afforded the financials to make some changes, we want to make sure that at the center of it all is the patient. And so everybody has a role to play. Everybody has a unique role to play in this transformation, from Maryville to the board of the hospital to all of our FQ partners. Everybody in this room has a role to play to make sure that we're providing safe delivery of our babies. So my focus, I heard someone ask about dads, I heard someone ask about seniors. There's a role for everyone to play to make sure that those services are provided, but my role is to take care of moms. And it is not lost on me that we're in the house of God right now. And I believe that our hospital is still open. Our labor and delivery unit is still open when St. Bernard closed their labor and delivery. Jackson Park closed their labor and delivery. Mercy Hospital closed their labor and delivery. Metro South St. Francis, the whole hospital closed. I could go on and on. And here's Little Roseland Hospital still standing. So I just believe that we are supposed to be there. And so while our doors are open, and while we have people all around us who are willing to take their precious time and energy, because all of us could be somewhere else, but we've chosen to be here. And so we have to do the work of making sure that our patients are well taken care of, one patient at a time. Every patient is deserving of the best care. So on this side of REACH, you know, the employees, that's our goal. That's what we're trying to do. But we need support. We need community support. One of our biggest KPIs, or one of our biggest goals, is to increase the number of women who choose to deliver at Roseland Hospital. And we know a lot of women don't come to Roseland because they want to, they have to. That's the closest hospital. But we want women to choose Roseland Hospital, not just because of the access to care, but access to people who care. We really do care. And our OB unit is in agreement with Stroger Hospital, and so our outcomes are reviewed. And so when we look at the things that are happening to our pregnant moms, our outcomes are no better or worse than any other hospital. But we tend to get a lot of attention for the negative things we do instead of the positive things we do. But we, just like you said, we take good care of our patients. And so we ask that anyone that you can direct our way, whether it's through your health center, if you're here representing one of the FQs, or if you're just a community member, if you can just let people know and let the community know that Roseland is in desperate need of support, and also we need to send a message that we're standing because we take good care of patients. Now, we could do better if we had more resources. That's clear. But when companies and when businesses and when government divest and pull out of communities like Roseland, then you see a downward spiral. And so we're trying to change that. We're trying to change that because we believe that the patients that live in the Roseland community deserve that. So we look for your support, we appreciate it, and we ask that you just send us some patience.
Good morning. So my name is Demuriel. I am a representative of Beloved Community Family Wellness Center. And so I did see, I'm usually not really good at speaking public forums, but one-on-one I can talk all day. But I am by trade a registered nurse. I am now the project manager for the collaboration with Roseland Community Hospital with REACH. And so I just wanted to get up and say pretty much everybody has said everything that I kind of wrote notes about. But I'm very excited. I've been a registered nurse for almost 25 years, and I've worked in community health, and thank you. So, but one thing about Beloved is actually in sync with exactly what the name is. So when I come in the morning, I'm like, good morning, Beloved. So we are caring people who care for others. So Dr. West, everything you said about the OB and labor and delivery, I appreciate that because I am an ex-resident of Roseland Community Hospital, Roseland Community. My grandmother raised us in the Roseland area, and I'm very aware of the issues that Roseland has and the high-risk area that it is. So I'm excited about sending patients over to, it's something new for me. I was the chronic care nurse, well, still am, the chronic care nurse at Beloved Community Family Wellness Center. And even though we don't get credit for it, we are actually in the business of care coordination, dealing with social determinants of health, assisting patients with housing and food. It's like a food desert over there. The food prices are very high in the stores that are in the area. So we're intentional about giving people resources. We have a lot of patients that come in and they have a lot of issues with food and housing and transportation. So hearing what Roseland is offering is exciting for me because I know that because we are in another area that is of high risk, which is the Inglewood area in the heart of Chicago, we do see what is needed for our community. So I'm just excited and wanted to say also, I'm not like, you know, this billboard for Beloved, but we do have an amazing behavioral health team. We recently signed a licensed clinical professional counselor. We have a LCSW. We have a psychiatric nurse practitioner who is also going to be collaborating with us with the REACH program, and also our LCPC. And then we have our behavioral health counselor, Ms. Nita Marchant, who is very excited about us. We're going to try to do a tour of both units, the OB, labor and delivery, and also the behavioral health unit. So I'm excited about that. Also with our CMO medical director, Dr. Lucero. She's going to accompany us with that once we all get together. So, but I am excited and I'm looking forward to the collaboration, and I just want us to do great things because people need people that actually care. Like, and that's the only way that you can get them to trust you. The main thing is trust. They need to trust us with their care. So, and I hate to see when people don't get the proper care that they deserve just because of the communities that they live in. So that's a big pet peeve of mine. So I'm excited. So thank you guys for this forum.
There we go. Okay. Did you want to say anything? Okay. Everyone's good? Okay. Well, we have gone over a little. I was going to end it. Oh, of course, ma'am. Yes.
Hi, I'm Eugenia Stepp, and I just want to share this with you because you're talking about Roseland, and I saw the other communities that you said that you're going to do this at. Every Tuesday morning, I'm going to Roseland for Bible study. So they have these churches, they have a lot of churches in Roseland. I'm a member here at Oakdale, but I'm just saying that because do you guys go over to those churches and have these forums over there? Because it would be a good idea to have some of the community people that are going to church every Sunday come out and listen to what you offer at the hospital.
Yeah, you know, that is actually an initiative of our wonderful marketing team. They are actually in progress of doing that right now.
Kingdom Covenant Church.
Okay.
And it's a big church.
Okay.
Yes.
Well,
109th and Kings Drive, right off Kings Drive.
Okay.
Can't miss it. It's a huge church.
Well, Rochelle,
And
will
there are a
definitely
lot
get that
of churches
information,
over
and if we are allowed to speak to
I'm
the
there
congregation.
every week.
All right. Well, you heard her. We could come.
But like I
speak.
said, I belong to Oakdale, but.
Got you.
Like you said.
Thank you. All right. Well, again, we went over a little time, but I just want to say thank you once again to everyone here. REACH truly appreciates you all coming out to here. I hope you all took out of this presentation, one, what REACH is, who we are, what we intend to do, and how we're going to impact the community. I hope we were successful in accomplishing all of that. And another thing, Yaya and Sylvia took my word, as they all know. Intentional is my word, and we are all of us, all of our partners. I'm speaking for you all. All of us are very intentional with making an impact in our community. We go full force for our patients in every way, shape, or form. It's not just simply, again, discharging our patient out into the community. We are making sure that they're going to be successful in their recovery process. So again, I hope we conveyed that messaging to you all. Once again, thank you for coming out, and we truly appreciate you. REACH team will be here. Our partners will be here for any follow-up questions that you all have. A couple of things before I dismiss you all. One, there is a survey in the back. We truly hope that you fill it out to, again, give us feedback with how we can improve our town halls or any outreach, further outreach that we can do for you all. And then two, there are refreshments downstairs. Please, again, congregate. Feel free to talk with our staff and things of that nature. So with that, thank you all very much and have a blessed day. Oh, I'm sorry. One last thing. Somebody left their Ben's keys. I will gladly take. Who? Okay, I was looking for them.